Picture this. You're standing outside the Mongboalu Hospital.
Right.
This is in the Democratic Republic of Congo, right near the eastern border with Uganda. And the air is just thick with smoke.
Yeah, it's a completely chaotic scene.
Exactly. Tents that were set up by Doctors Without Borders are literally burning to the ground.
Yeah.
Medical staff are just frantically trying to evacuate.
It's devastating, and, I mean, it really highlights a very specific breakdown in how we manage global health right now.
Yeah, and the most alarming part of this picture for you as a listener is that the people attacking the facility, they aren't some rebel army.
No, they aren't.
They're young men from the local community. They're angry. They're utterly terrified. And they're demanding that the doctors hand over the bodies of their relatives who just died of Ebola.
Which is incredibly dangerous. I mean, those bodies are highly infectious.
Right. And in all the confusion of the fire, several patients who are potentially infected, they just vanish. They melt right back into the dense local community.
Which, that creates an immediate accelerant for the outbreak. When infected individuals disappear back into a dense population to hide, containment just becomes almost impossible.
So for today's deep dive, we are exploring this exact crisis. We're looking at why the current Ebola outbreak in the DRC is completely outpacing the global medical response, at least according to reports from DW News.
Yeah, we really need to unpack what the World Health Organization and the doctors on the ground are encountering.
Definitely. But more importantly, we're going to examine a radically different solution that's detailed in our sources. It's a system called Dr. Maya AI and these Prima kiosks, which were created by Dr. Kadiali Srivatsa.
Right, because the sources make a really compelling argument here. They say the traditional top-down methods of managing an epidemic,
Like enforced quarantine and lockdowns.
exactly, lockdowns, centralized lab testing, all of that, they argue it's failing because it fundamentally misunderstands human fear.
So the tension we're looking at today is that the answer to stopping a pandemic might not be a bigger hospital or, a stricter lockdown.
Or even a faster lab test.
Right. It might actually lie in empowering the public to self-diagnose and isolate before they ever set foot in a medical facility. But to understand how we got to burning tents, we really need to look at the ground reality in the DR Congo.
Yeah, based on the DW News reporting, this epidemic is just moving way faster than the containment efforts.
So what's going wrong there?
Well, there's a combination of factors creating a perfect storm. It starts with a huge blind spot in the initial medical response. You see, health authorities were actively testing for Ebola, but they were using tests designed for a previously known strain of the virus.
Wait, how does that even happen? Like a test just misses the virus completely?
It comes down to how PCR tests are designed. So a PCR test, which is the standard diagnostic tool, it looks for a very specific genetic sequence.
Okay, like a fingerprint.
Exactly, fingerprint of the virus. So if the virus mutates, or if a different strain emerges with a slightly different genetic fingerprint.
The test doesn't see it.
Right, it simply won't detect it. It just returns a negative result. So the doctors might assume the patient has malaria or typhoid, which are super common in the region.
Wow. So because of that initial mismatch, the outbreak just spread completely undetected for a crucial window of time.
Yep. By the time they sequenced the new genome and realized what specific strain they were dealing with, there were already an estimated 1,000 infected people.
That is a massive head start for a lethal pathogen. And the geography and demographics of this specific area, they kind of compound the problem, right?
Yeah.
DW News highlighted that this is a major mining area.
Yeah, which brings in a highly transient population. Workers travel there from all over the region.
And when they start showing symptoms.
Their first instinct is almost always to travel back home to their families, so they're taking the virus across regional borders.
That's a nightmare scenario for containment.
It is. And furthermore, the area is heavily populated by internally displaced persons, or IDPs. These are communities driven from their homes by regional conflict.
So we're talking about people who lack the most basic resources.
Exactly. Many don't have access to clean running water. Some of the informal camps don't even have latrines.
Which makes standard public health advice sound almost absurd. I mean, you can't tell a community to wash their hands frequently with soap and isolate in a separate bedroom if they live in a crowded tent and don't even have a toilet.
The physical reality makes traditional infection control nearly impossible there, and this circles back to the chaotic scene at the Mongboalu Hospital.
Right, the burning tents.
Because this specific community hasn't experienced Ebola outbreaks to this severe degree before, and because they've been living in a constant state of conflict and displacement.
There's a profound lack of trust.
A huge lack of trust in any central authority. When the government or foreign doctors show up in hazmat suits, people are deeply suspicious.
They deny the disease is even real, right?
Yeah, rumors spread about the virus being a hoax or even a deliberate weapon. So when someone gets sick, families hide them at home instead of seeking treatment.
But hiding a highly contagious Ebola patient in a crowded dwelling, that practically guarantees that the entire family will contract the virus. It's like trying to fight a forest fire while actively throwing gasoline on it.
It really is.
Still, I find myself trying to understand the psychology here.
Yeah.
Attacking the doctors, trying to save your life, it just seems completely counterintuitive.
It does, but it helps to view it through the lens of a person whose entire life has been upended by conflict, and now they're facing this terrifying, invisible threat.
So fear takes over.
Completely. When people are that afraid, and they lack trust in the system, a healthcare center isn't viewed as a place of healing. It's viewed as an institution of finality, a place where you go to die.
Wow.
They see it as a system that will forcibly rip your family apart. They isolate you behind opaque plastic sheets, and if you pass away, they won't even let your family perform traditional burial rites.
Which are deeply culturally significant. So they just see their loved ones disappearing into a white tent and never coming back. That really contextualizes the fear. The current public health approach demands that terrified people completely surrender their bodily autonomy to a system they fundamentally do not trust.
And when human beings are pushed into a corner and stripped of their agency, they fight back.
Yeah, that makes sense. Now, our sources use this localized chaos in the Congo as a jumping-off point for a much broader critique, right, about how the international community handles disease in general.
Yes, they argue that the violence in the DRC is just a highly visible symptom of a massive systemic failure. The sources are incredibly critical of the traditional playbook used by the World Health Organization and the CDC.
They actually describe the reliance on lockdowns and forced quarantines as an illusion of theoretical idealism.
Which is quite a phrase.
It is.
Yeah.
I want to break down that phrase, theoretical idealism, because it kind of implies that the global health strategy looks great on a whiteboard, but completely fails in the real world.
That is the core of their argument. On paper, in a sterile laboratory setting, a lockdown makes perfect sense. You identify the pathogen, you restrict movement, and the virus dies out.
Simple math.
Right. But in the practical reality of managing 8 billion human beings in a highly interconnected world, it falls apart.
Because humans aren't predictable variables.
Exactly. The sources point back to the WHO's Ebola response in 2014 and 2015, which, resulted in over 28,000 deaths. They characterize that response as a disaster specifically because the system relies on slow, centralized lab testing.
Yeah, the reports mentioned the central lab in Kinshasa as a primary example of this bottleneck. Like, how does that process actually work?
Just think about the logistics required. A doctor in a rural clinic has to take a blood sample or a swab. That physical sample has to be packaged securely.
Put on a truck?
Driven across rough terrain, maybe put on a plane, and flown to a central lab in the capital city.
Wow.
Then it has to be processed, which takes time, and then the result has to be communicated back. This process can take days. Meanwhile, the patient is just waiting.
And here is where the traditional playbook seems to actively backfire, right? Because when you enforce centralized testing, you are demanding that symptomatic people and asymptomatic people all travel to the exact same locations.
Yes.
The waiting room itself becomes a super spreader event. The very mechanism designed to identify the virus accelerates its transmission.
You bringing highly infectious people into confined spaces with people who might just have, like, a common cold.
Exactly.
Okay, I hear that critique, and the waiting room dynamic makes complete sense. But let me push back on the underlying premise here. Isn't gathering people at centralized labs, or at least relying on those labs, isn't that the only genuinely scientific way to know what we are actually dealing with?
You mean for definitive proof?
Yeah. We can't just guess who has Ebola. We need blood tests. We need PCR swabs to confirm the pathogen. Without the science, aren't we just flying blind?
Well, the sources address that exact tension. They acknowledge that centralized labs absolutely confirm the science, but they argue that the system completely fails the sociology.
Fails the sociology. Meaning what? Meaning the centralized model assumes people are rational actors who will just calmly wait for a diagnosis in a designated area.
Which we just established they don't.
Right. To actually stop an outbreak, a perfectly confirmed lab result that arrives 5 days too late is completely useless. The priority has to be identifying and isolating individuals before they travel.
You need to catch the infection before the person has sat on a crowded minibus for 3 hours to get to that hospital waiting room.
Because once they're on that bus or in that waiting room, the secondary infections have already happened. The goal of public health shouldn't just be to scientifically document an epidemic. It should be to prevent it.
And you can't prevent it if your primary diagnostic tool requires moving infectious people across a map.
Precisely. And that brings us to the alternative. If forced testing and centralized hospitals are failing and actively generating the kind of fear that makes people burn down medical tents,
The system needs a total redesign.
it does. And this leads directly to the solution proposed by Dr. Kadiali Srivatsa. It revolves around a concept of returning agency to the patient.
Right, the sources introduced Dr. Srivatsa's creation, the Dr. Maya AI system, and this is deployed through what he calls PRIMA kiosks.
Yes, PRIMA, Primary Emergency Medical Assistant.
So how exactly do these kiosks function in a real-world setting?
The philosophy behind them is really a synthesis of ancient intuitive wisdom and modern technology. Dr. Srivatsa references Charaka, who is one of the principal contributors to Ayurveda.
Okay, so ancient Indian medicine.
Right. Charaka believed in empowering laypeople with symptom-based knowledge so they could manage their own health. The Dr. Maya AI takes that philosophy of symptom recognition and scales it using complex AI pattern matching.
So it's not trying to replace the doctor.
Not at all. The goal is to act as an incredibly smart frontline triage system that anyone can use regardless of their literacy level.
And I think it's important to explain how a person actually interacts with this AI, especially in an area with low literacy, because it's not like a text-based WebMD search.
No, not at all. It uses voice guidance in local languages and a very simple, color-coded outcome system.
So the user just walks up to it.
Yeah, the user approaches the kiosk and simply speaks. They describe their symptoms in their native dialect. The AI parses those vocal inputs, cross-references them against massive medical databases and current epidemiological data.
And then it categorizes the risk.
Exactly, into one of 3 color codes.
Okay, let's walk through those codes, starting with the most critical.
Red means the AI has identified a genuine, immediate medical emergency, like a severe trauma or a critical acute condition. The advice is clear. You need to get to a hospital immediately.
Okay, and what if it's not a red code?
Then you have yellow or green, which indicates mild symptoms. The AI advises the user to manage the condition at home or maybe consult a local chemist or a nurse.
Just basic home care.
Right. And crucially, in these cases, the AI often educates the user that they likely have a routine viral infection and explicitly advises them to avoid unnecessary antibiotics.
We will definitely circle back to the antibiotic issue, because the sources tie that directly to the survival of modern medicine. But for the Ebola scenario in the DRC, the most important color is blue, right?
Yes. Blue is the infection risk protocol. If the AI detects a pattern of symptoms, like specific hemorrhagic signs combined with fever, that suggests a highly contagious infection like Ebola, it hits blue.
And what does the kiosk tell the person to do?
The advice given to the patient is isolate at home immediately and get remote help. Do not get on a bus. Do not walk into a crowded clinic.
The design is just brilliant in its simplicity.
Mm.
I mean, it's like a public telephone booth or an ATM or something, just a piece of community street furniture.
Exactly. It's objective and incorruptible.
But this is where I really have to challenge the physical reality of this solution. We are talking about deploying technology in a conflict zone,
Right.
a place where, as we just discussed, people lack clean water and are burning down hospitals. How does a pristine, highly sensitive computer kiosk survive without getting looted or vandalized or just destroyed?
It's a valid question.
And how on earth is an AI supposed to process voice data and send alerts to the WHO without reliable internet infrastructure?
Well, those are the exact logistical hurdles the deployment of this technology has to solve. To address the infrastructure first. These kiosks aren't relying on, high-speed fiber optics.
Oh, they aren't.
No, they're designed to operate more like rugged telecom infrastructure. They run on solar power, and they can transmit basic telemetry and symptom data using low-bandwidth cellular networks, or even mesh networking.
Mesh networking.
Yeah, where kiosks bounce signals off each other until they reach a node with satellite connectivity. The data packets required to log a blue con are tiny.
Ah, so it doesn't need to stream data, it just needs to send a digital flare.
Exactly.
But what about the vandalism aspect?
That goes back to the psychology of the community we were talking about earlier. Think about it. Why do people burn down the hospital but leave the local water pump alone?
Because they need the water.
Right, because the hospital represents institutional enforcement while the water pump provides autonomous value. A doctor in a hazmat suit represents the power of the state. They have the authority to detain you or force you into quarantine.
But the kiosk doesn't.
The kiosk doesn't have arms to hold you down. It doesn't enforce. It merely listens, advises, and educates in a language the user actually comprehends.
Because the user knows they can just walk away at any moment, they remain completely in control.
Exactly. And by removing the fear of being locked up, you remove the single greatest barrier to honest reporting.
That makes total sense. A terrified person might lie to a human doctor to avoid being thrown into an isolation ward.
But they have absolutely no reason to lie to a machine that is simply giving them private information. It treats the public as partners in their own healthcare rather than as subjects to be managed and controlled.
That reframes the entire dynamic. If you take away the threat, you get the truth. But let's scale this up a bit. Say I'm an individual in a village. I feel sick. I use the Prima kiosk, and it gives me a blue code. I go home and isolate.
Good.
That is fantastic for me and my immediate neighbors. But how does that individual action actually help the World Health Organization stop a massive outbreak?
This is where the Dr. Maya system shifts from being just a personal health tool to a global defense network. The sources describe these kiosks as transforming everyday citizens into a decentralized nervous system for the planet.
A decentralized nervous system.
Yeah, every time someone uses the kiosk, they're acting as a voluntary biological sensor.
So the data aggregates.
Precisely. If one person hits the blue code, they get personalized advice. But if 10 or 50 people in a specific neighborhood all hit the blue code on their local Prima kiosks within a 48-hour window,
The AI sees the pattern.
the central AI recognizes the cluster. It instantly alerts public health officials to a localized outbreak. And the crucial metric here is time.
How much time?
The sources note that this decentralized reporting can identify an outbreak 7 to 14 days before the first corresponding spike in hospital admissions.
Wow. It sounds like the difference between weather forecasting and disaster recovery.
That's a great way to put it.
Right now, our global health strategy is like waiting for a massive satellite to confirm a hurricane is happening while our living room is already underwater. We don't act until the hospitals are overwhelmed.
Right.
But a decentralized network of Prima kiosks, that's like millions of people simultaneously looking up and reporting the very first drops of rain.
You're catching the outbreak when it is just a spark. And we really have to recognize that this technology isn't just about managing Ebola in the DRC.
What else is it for?
Dr. Srivatsa and the sources heavily emphasize that this decentralized approach is critical for human survival in the face of another looming threat, the post-antibiotic era.
Driven by antimicrobial resistance, or AOM. Let's unpack the mechanics of AR, because the sources frame this as an existential crisis that the kiosks are uniquely positioned to fight.
Well, to understand AMR, you have to look at how we currently misuse medicine. Antibiotics only kill bacteria. They do absolutely nothing against viruses.
Right, viruses like the flu or a cold.
Exactly. But people all over the world routinely take antibiotics for viral infections like the common cold. And when you do that, you aren't curing your cold. Instead, you are killing off the weak, susceptible bacteria that naturally live in your body.
Leaving behind only the strongest, most resilient bacteria.
Yes. Those strong bacteria survive, mutate, and multiply.
We are essentially running an evolutionary training camp for superbugs inside our own bodies.
That's exactly what's happening, and those superbugs spread. The sources mention a terrifying statistic, actually. By the year 2050, if current trends continue, antimicrobial resistance could kill 10 million people a year globally.
10 million a year.
In a post-antibiotic era, a simple scratch from gardening, a minor chest infection, or a routine surgical procedure could become as lethal as Ebola because we simply won't have the drugs to fight the infection.
And this is where the Prima kiosks come back into play, specifically with the yellow and green codes we talked about.
Exactly. When a user approaches the kiosk with a viral cough, the AI categorizes the symptoms and explicitly educates the patient. It tells them, this is viral. Do not take antibiotics.
So it stops the misuse right at the source.
By democratizing that triage and education at the street level, the kiosks act as a dam against the irrational use of antibiotics. If we don't deploy a decentralized early warning and education system globally, minor infections will become untreatable.
And the threat of superbugs doesn't respect international borders. I mean, what happens in a mining camp in the DRC, a crowded market in Mumbai, or a suburb in London, it's all connected. The pathogens just travel on airplanes.
They absolutely do.
If we can't catch these outbreaks early, and if our antibiotics fail, Our only remaining tool is to lock everybody in their houses again.
And the traditional healthcare system simply does not have the manpower or the resources to place a human doctor in every village or on every street corner 24/7.
But you can deploy a network of intelligent kiosks to fill that gap.
Yeah.
It is an incredibly compelling vision for the future of global health. Let's bring this all full circle for you listening. We started by looking at a tragic, chaotic scene in the Democratic Republic of Congo. Tents burning, doctors fleeing, and an epidemic completely outpacing the containment efforts.
And what that tragedy vividly illustrates is that fear kills just as efficiently as any virus. The traditional playbook, well, the theoretical idealism of forcing terrified, uninformed people into centralized testing centers, it's breaking down in real time.
Yeah.
It's a system built on institutional enforcement. And human nature will always rebel against enforcement when it's driven by panic.
The Dr. My AI and the Prima kiosks represent a profound paradigm shift. It's about moving away from a system that manages patients through fear and moving toward a system that empowers the public through education and transparency. It's about treating you, the individual, as a capable partner in global health.
It gives communities the tools to understand their own bodies, to conquer their anxiety, and to make the responsible choice to isolate before they inadvertently spread a deadly pathogen. It builds a decentralized, global nervous system that operates on a foundation of trust.
Which leaves us with a final, lingering thought to mull over. In our highly advanced modern medical world, we have been conditioned to believe that our ultimate salvation against the next pandemic or the next untreatable superbug will come from a laboratory. We tend to think it'll be a newly synthesized chemical or a groundbreaking vaccine.
We constantly look to science for a physical shield.
But what if, based on everything we've unpacked today, the ultimate weapon for human survival isn't physical at all? What if it's entirely psychological? What if the only way to save modern medicine and prevent the next burning hospital is simply giving you, the patient, your free will back?
It forces us to rethink everything about how we administer care.
It really does. Something to think about the next time you find yourself sitting in a crowded, urgent care waiting room. That is all for today's deep dive. We'll catch you next time.